Welcome back to the KOM Morning News on this Medday Thursday. Earlier, we were kind enough to be joined by Jennifer Meister of Mercy Joplin. She's a registered nurse down there who works in their bariatric support program. And we were talking about the options when it comes to people who have really exhausted all the other options as far as weight loss because they're doing their best to try to stay healthy and live a quality life. Jennifer, I want to thank you for returning with us here on the show. I guess the first thing that I'd ask you is, this is not, I used the term earlier, one-stop shopping. This is not for people who are looking for a bathing suit body during summer. Who are the people that need to be like, this could be for me?
So the type of patients that would want to come and have bariatric surgery, they use the body mass index measurement to determine who would qualify. So typically patients that are greater than a 35 body mass index with any of those comorbidities I mentioned earlier, the hypertension, the diabetes, the obstructive sleep apnea, they would qualify. Or if there was a patient who had a BMI that is greater than 40, they would qualify without any of those comorbidities. So it's someone that has usually on average 100 or more pounds to lose.
So with that being said, now that I know the qualifications, my question to you would be, where do I start? Do I need to go to my primary physician? Do I come to you directly? Maybe I don't know what these numbers are or what they mean.
So you can find a body mass index calculator online, and it takes your height and your weight and it produces this number. So anybody can access that online and figure out what their BMI is. If they're interested in surgery, they can go to their primary care provider and get a referral to our program, or we also have seminars, which would be the first step, whether they had received a referral from their primary care doctor to come to us. The seminars can be done virtually or they can be done in person. And once you've gone to the seminar, you learn about the procedures that we offer, and then you would move on to your next step.
I'm so glad you brought up those seminars because they're not only educational, but they're also very visual. And the fact that people are able to see the process that they go through, not only into the surgery, but also post-surgery as well. But surgery is still a scary word, even though the medicine and non-invasive and less invasive have come so far. So I would ask you, as far as the process goes, is there one surgery that fits all patients? Are there different surgeries? What does that kind of look like?
Well, Dr. Liu here at Mercy Joplin offers two different procedures for weight loss. One is called the sleeve gastrectomy, or the gastric sleeve, that reduces the size of your stomach, so it causes a reduction in the size and what you can put into your stomach. And then the other procedure that he offers is the Roux-en-Y gastric bypass, which not only restricts the size of the stomach, it also bypasses part of the bowel, so you have you don't absorb as much through that, so you don't absorb as many of those calories. So it's twofold. Those are two pretty gold standard surgeries. Those are done pretty much in a lot of places, but that's what is offered here. And it depends on your health, how much weight you have to lose, and at what point you are in your life as to which surgery would be most appropriate for you. Both will provide weight loss. The gastric sleeve will provide about 60 to 70% of your excess weight loss. I mean, that's a good average of what you would lose, where the gastric bypass would provide about 70 to 80% of that weight loss. So it just takes into account a multitude of things, and that's a decision that would become from the patient and with the doctor. They would work together to make that decision.
And I'd like to reiterate one thing that Jennifer said when she was describing those. Those are the gold standards. There's the research, the statistics, and the quality of life afterward that backs those up. So thank you for explaining those. Jennifer, one last question before I let you go take care of patients. How do we get in touch with you at Mercy Joplin as far as the weight loss surgery program goes?
You can go to our website, and that is where you can get more information, see patient testimonials, as well as register for those seminars. And that website is mercy.net/bariatricsjoplin. And you can go to that website and get all the information on how to get a hold of us.
Jennifer Meister, registered nurse at Mercy Joplin and part of the bariatric program and the weight loss surgery program as well. Jennifer, I want to thank you so much for your time on this Medday. And also, too, we look forward to having you in the future.
Yes, thank you so much for your time.
Thank you very much. Be safe, ma'am. We'll be back with more KOAM Morning News right after this.